moment to breathe, grab a beverage or two. We got professional guests with lots of stories for you. So take a seat right here and join us on Careers Over Beers.
All right. Welcome to Careers Over Beers podcast. My name is Jesse Krause, the host, and I have a very special guest sitting across from me today, my very own eye doctor. Go ahead and tell us who you are, man.
My name is Hector Rios.
Hector Rios.
Yes, sir.
And you give sight to the blind.
No.
No?
Unfortunately, if you're blind, there's nothing we can do.
Nothing you can do?
No, exactly. I help you see better.
You help me see better.
Yes, if you have sight.
Well, if
you're blind, I'm sorry.
If I'm legally blind, though.
If you're, well, you know that is a very misunderstood term. Legally blind refers to, you've seen the chart, you know, the big E.
The big E on the top.
And the next two down, that's 2,400. The next two down is 2,200. Legally blind is you can't see that or better with best correction. Okay. With best correction, with correction, period. So people that can be legally blind, people like macular degeneration, really bad glaucoma, or congenital diseases, or diseases that are progressive to vision. But if, like your mom, she's not legally blind.
She claims that she is.
You know, she's wrong. This is, I hope we're not doing a HIPAA violation here. I said your mom, I didn't mention her name.
You didn't mention her name at all, no.
Or date of birth. But your mom, if I couldn't correct her any better than she is without her glasses, then she'd be legally blind. So that's one of the things I hear all the time. My dad is legally blind without his glasses. Like, that's not the definition. And we don't go into too often. But yes, I am.
You're not out there calling people out all the time.
I help you see better.
You help us see better.
Yes, exactly, yeah. So.
And for that, we thank you, sir.
Oh, thank you.
You brought some beer today.
I did.
You wanted to bring this in for me.
Yes. Have you ever had hazies?
I have had a hazy, and
Okay.
You know what? I actually think that I've had Joko juice before.
Oh, you're a good man. Awesome. That's good.
I have, yeah.
Did somebody force you to have it, or do you actually bought it yourself?
I think that, if I remember correctly, somebody wanted a hazy IPA on this podcast at one point. So I went to the liquor store and I was like, hey, do you guys have any hazy IPAs here? You know, preferably local, because I like to support local breweries and beers. And he gave me this, I believe.
Did you go to Auburn?
No, this one was actually way out east where I work.
Okay.
So not a local
cool.
one around here.
Well, hazies are relatively new in the industry of a microbrewery.
Yeah.
They maybe been around 5 to 8 years, give or take. And the difference between these is it's, you know, an IPA is, of course, but what makes these different is that instead of using all barley, we use oats, wheat, and oat flakes, or barley flakes. And, and that gives it a hazier appearance, but it has more in it it gives you more mouthfeel, has more taste to it, or because you're actually tasting more. And a lot of those use lactose sugar, and people think is that milk? No, well, lactose is a sugar that is found in milk, but it's not.
Does it give it like a creaminess, sort of?
It gives it more of a flavorful, a less bitter taste. And as opposed to a regular IPA, there's less what we call bitterness, so it's not as sharp, and it gives you just a more full feel and not as much bitterness.
I gotcha.
I think they're the craze right now. So
are they really?
Yeah.
Are you into microbrewing and craft beers?
Yeah, and I started microbrewing my own beer in '95 or so.
Oh, really?
I had to stop.
And you were way ahead.
I had to stop after a while just because I was doing a lot of woodworking at one point, and it was in my my garage, and I was also brewing beer in that garage, and I was doing so much woodworking that at one point I started, because of enough dust in there, leftover dust in the air. My last 2 batches were horrible, and I realized it was because of what was going on in my shop, and I had to decide between microbrewing or enjoy my woodworking, and I'm thinking I can always buy beer, right? So,
you were making hazy IPAs before with sawdust.
They were bitter hazy IPAs.
Yeah.
It was really, really disgusting. So, but yeah, so I've gone through several phases of what I like as far as
that's
beers.
Way ahead of the curve.
Yes.
You know craft beer has really blown up in the past decade, but
it has been.
So to be doing that in '95,
yeah, it was.
Nobody else you knew was probably doing that.
Yeah, there were a few.
Were there?
I was doing it. I was doing it old style. You take a grain grinder by hand and grain all the grains, and one time I didn't make my wife very happy. I was brewing an oatmeal stout, and I started grinding the oats at 9:00 in the morning. Church was at 11. I missed church because of doing that, and I didn't start the fermentation stage of that beer until 2:00 in the next morning.
Oh wow!
Yeah, that was labor of love, and I will never do that again. But yeah, I my name was Dirt for a while after that one. I dedicated my whole day to and not parenting, but making
some beer.
Yeah, exactly. So.
Well, let's bust into these, man. Let's do it.
And you said you've had it before, so that's good.
I have had one before.
So now, before we bust into it, okay, tip it over.
Tip it over.
Swirl it a little bit, okay, because with these hazies, a lot of the haze sediments works its way down to the bottom. So you swirl it that way you can work it out, and then you have a more even haze.
Am I going to look like a dork if I do that when I'm at a bar somewhere?
No, people know
what I'm doing.
People know what you're doing. Yeah, exactly. So
it's kind of like kombucha. Then it has like a, yeah. I don't. What's the face you're giving me there? You know, like.
It's definitely different than kombucha, for sure.
Well, I'm just talking about like everything that settles on the bottom there.
Yes, but the taste is not like, definitely, there. You bet, things settle, and you want to make sure you mix them in. Instead of getting everything at the very end, you're at least getting it all the whole time you're drinking.
I definitely screwed that one up when I had this last then.
Okay, and at the bottom you're like, it tastes different, right?
I don't remember, but cheers, man.
Cheers. Nice coasters.
Thank you. You know what I like about this is it's not so hoppy.
That is the big thing with them too. Is you know you have a lot of people that try IPAs and like, wow, that just
like, dang,
it is bitter, and that's an acquired taste. Bitterness on a
definitely
beer.
is.
It really is, because I love some bitter beers, but they can affect what you think about them if you don't you're not drinking it in the right aspect. And a lot of times too is if you're drinking more than one kind of beer, what you drank last can affect the palate for what you're drinking next, and it's just like, wow, so it's better to drink a bitter beer and then a less bitter beer next instead of a less bitter beer and a more bitter beer.
And it's a shock.
It just slaps you in the face.
It does, yeah. Really does. We used to back in college and high school and stuff. We would drink Rolling Rock sometimes. If you ever had that beer. It has a distinct flavor to it.
Unfortunately, I have.
Yeah. It has a very distinct flavor to it. So we always, we figured out that it's okay. If you buy Rolling Rock, you start with Rolling Rock, you stick with Rolling Rock.
Yes. Or you work your way up.
Now, if you veer away from that and you go to like a Natty or a Bud Light, and then you go back, it's like, oh. Or if you start with Bud Light and then you get on Rolling Rock, it doesn't work.
Unfortunately, I've been lower than you. I drank a Schaefer Light in college.
Schaefer Light. I don't think I've ever had that.
$2.94 for a 12-pack is pretty darn good on the college budget.
Yeah, that'll do.
And if you haven't had it, don't. That is just.
I kind of want to now.
Okay, well, at your own, but you can have you have a 12-pack.
Yeah,
you're probably not going to finish that. You'll give it to somebody you like, right?
Is it still $2? You think it's probably like $3 now?
It's probably $3.50, $3 or $4. Yeah, I don't know if you can find it. I don't know.
I've never even seen it, to be honest.
There you go. There's probably a reason for that.
Now I'm going to search for it.
Okay, there you go. That gives you something to try.
All right, Dr. Rios, tell me how you got into the world of. You're an optometrist, first of all, right?
Mm-hmm. Yes. I've always had an interest in healthcare since I was young. Just in this, I was always really big into biology, and of course, I think most of the time, at least, you into the medical field. Mm-hmm. Most people that if you're going to be any kind of medical doctor, whether it's an optometrist or dentist, of course, a medical doctor, a veterinarian, you usually have a sincere interest in biology, and you start thinking about things. What am I going to do after high school? And
right.
About 10th grade, it started hitting me what I'm going to do. Of course, I was thinking medical doctor. My first thought was veterinarian, and then that sophomore year, we had to put my cat down. That stung.
Yeah.
And I thought, I don't know if I could deal with that on
do
a
that
semi-regular. Don't get me wrong, you're healing. You're really helping people out.
Right.
But you're still dealing with death.
Mm-hmm.
And so I don't mean to rub anybody the wrong way. I don't want to dig anybody's mouth. And then when you're a medical doctor, a lot of times you're dealing with sickness, sick people. which is fine, but you're dealing with that. And I always seem to enjoy going to my optometrist's office for visits. And, and I got to thinking, most people are healthy. They're just going for actual eye exam. And it's come out to be a great decision for me.
Yeah.
Most everybody comes in is in good health, and we're having a good time, and it's really neat. Every person's different. Everybody has a different outlook on life, different personality, and most are in good health and relatively happy. So it's been a really good profession for me so far.
You're not really dealing with people at the end of their life or people that are in traumatic injuries or anything like that.
Correct. No,
most of the time people leave the eye doctor and they're like feeling so much better about themselves because they're improving their vision.
You bet.
Right?
Exactly. And of course I do deal with people with glaucoma and macular degeneration that are they're losing vision, and just do the best you can to help them out and refer to the proper specialist when necessary. But overall, you're dealing with a relatively happy and healthy population. And everybody's, like I said, it's just you turn the page with every patient. Everybody's different.
Yeah,
I really do enjoy it. And I have two practices, one here in Colwich and one in Wichita, and they both had definitely different patient profiles. And I do enjoy the diversity that I see. So
that's cool. Do you have people that lie to you sometimes, like
of course,
patients that come in?
Kids mostly.
Kids lie to you?
They want glasses. And
that's crazy, right?
Yeah, who wants glasses, right? But the funny thing is I have a funny story leading to that. Early on in my career, I had two boys. I think they were 2 years apart in age. I think the first time they started seeing me, they were 9 and 7. And when I first saw them, big brother needed glasses, little brother didn't. Okay. When they left, little brother left crying because he wanted glasses. And he was lying to his teeth, trying, I can't see that. I can't. No.
Yeah.
You can't fool the doctor.
Yeah.
This went on for about 2 or 3 more years. And then finally, when he's about 10 years old or so, he needs glasses. Well, guess what? He left the office crying because he didn't want glasses
Things
anymore.
changed. He grew up and
right.
Yeah.
So, no, I do have patients. It's not very often. And they're mostly children because, they have a cousin or a brother or sister that wear glasses, and they think that's a cool thing, and they want to.
Do they try to fake the eye exam?
They do.
When you're looking at the chart?
I can't read that. Yeah, you can. You're just telling me you can't.
You can tell by their reaction usually.
Well, there are different tests we use to tell what a patient's prescription should be. And if you're off the charts on what you're reporting, what we see, okay, either there's pathology going on,
BS on that,
or yes, and we usually don't. We just kind of, I'll slip a note to mom. And I have a pre-made note actually. Your child's vision's fine. They want glasses and so on. So I have them, and I just slip it to the parent and say, read that, and I say, we're good to go. See you next year. And the kid walks out like, hey, what just happened? I want glasses. So, but every now and then we get that.
There was a craze, when I was a kid, probably like the mid 2000s. Where people were getting glasses and the lenses were just clear, just I mean, not they're all transparent,
because
but
it's just the look. Right?
Just the look, yeah. People just wanted them with just regular glass lenses where there was no prescription or anything, and just because they wanted to wear glasses,
they are an accessory, and
they kind of are, yeah.
I mean, I know some people look really, really good in glasses. It just fits.
Some people take their glasses off, and you're like, whoa.
Yeah, put them back on.
Yeah.
And it's amazing. Some people do look smarter in glasses.
True.
It's just for some reason. It's just it's their fit.
Maybe I should wear glasses on this podcast. People would take me more serious. You think?
Because they could see you through the.
Yeah.
Just tell them you're wearing glasses.
I would just look like this established,
exactly.
like smart.
Speaking of which, Mr. Krause, do you remember your first eye exam with me?
I don't.
You shouldn't, because you were 3 at the time.
I was 3?
Yes, you were.
Okay, tell me about that.
I happened to look back at your chart today when it was coming in. It was August of 1998. So you were 3.5 years old. Your mom brought you in for your 3-year-old screening because, of course, your mom's vision's not great. But,
right.
You did fine. You did good.
I did good?
Passed with flying colors. You did fine.
So my vision was, can you even tell in a 3-year-old if their vision?
Oh, yeah, you bet, definitely.
Really?
Yeah. Some kids do really well with a chart that we have that has figures, like a bird, a birthday cake, a hand, things like that. So, yeah, most of the time, about that time, kids will be able to verbalize things to you. But a lot of times, too, we have them at that age, that's the age of stranger danger, and sometimes I don't want to talk. So, but like I said, once again, we can do tests that can determine approximately what your prescription is. So, it's usually a no-brainer as long as we don't have tears, because once you start crying, sorry, game over, because the eyes close, there's watery eyes, and there's no participation.
I thought you were going to say I did something crazy.
No, you did perfectly fine.
You kind of looked at me, you're like, you remember?
You're very astute. You did really, really
1998.
Well. Yeah.
What's changed in optometry since 1998?
Well, the biggest things that have changed is technology and how to analyze the retina, digitally speaking, with certain types of instruments to determine at what level of damage there is from like glaucoma or diabetes. Now, right about the time you were before you were born is just before the time before LASIK came around to the United States. So now, having said that, LASIK has been pretty much has not. You really can't change too much what LASIK does. So LASIK's been pretty stable then. Another thing that's changed in optometry is when patients have cataract surgery. You can have implants that have a bifocal in them. They're not for everybody, but that is an option that's available. And also, before you were born, there were not extended wear contact lenses, and now we have those that patients can wear up to 30 days without taking them off. Not everybody can do that, of course, but that is an option that's available, and that's been a mainstay in our fitting for patients. Now, I don't recommend going 30 days because a lot of times patients push that fringe, and it's always good to more regularly replace them. But it really helps people that just want the ease of not having to mess with taking them off, putting them on again. As far as
luckily, I've never had to wear contacts.
No,
but you know that. But a lot of people that I am friends with obviously wear contacts. A lot of people out there in the world wear contacts. And it would freak me out a little bit, I think, especially some of the horror stories that I've heard of people sleeping in them too long, and
correct.
That kind of freaks me out.
Well, a lot of things, a lot of the problems that come about with contact lenses come across or a result of poor compliance.
Yeah.
One of the great things, another improvement or development since you were born, is daily disposable contact lenses. Back when I was in high school, or even after that too, you're wearing one pair of contact lenses for about a year or longer.
Yeah.
And a lot of issues come across from that.
I mean,
it's just
that's taking them in every day.
But still, it's putting the same lens in your eye
same
every
lens
day.
back in every
Even though you
day.
try to clean it, it's still a long-term issue. And I have patients from that era that have developed corneal issues from those contacts. And of course, that's all we had available to us at that time. But when you abuse it, that's when patients get
right.
problems.
But they've gotten better, you think, since then?
Oh, definitely. Like I said, the extended wear contact lenses are just great. We use them even to treat some patients with ulcers. I just had one patient that has an ulcer or had an ulcer, should I say, and we were at the latter stages of the healing of that ulcer. We put what we call a bandage contact lens. It's extended wear material, and she's been wearing it for over a week, and it allowed the eye to heal really, really quickly.
You mean there was an ulcer inside of the eye?
No, not inside, outside the cornea, the clear part of the eye.
An ulcer on the cornea.
The clear part of the eye. Yeah. There you go.
So
right there. Don't touch that. But yes, right there. Yeah.
So the whole clear part around your eye is the cornea.
The cornea. Yes. Right. Mm-hmm.
And you can develop like a sore on that.
Ulcer. Infections can cause, just like you can get an ulcer in your stomach, you can get an ulcer in your cornea.
Really?
Most of the time, those are from infections.
Sounds scary.
They are pretty scary. And you're always red lights come up when you see an ulcer. And this patient I saw every day, including weekends, for a week and a half, just because you want to stay on top of things.
Yeah.
So
make sure nothing's getting out of hand.
Correct. But the nice thing about the extended wear contact lenses and that are bandage lenses as well is you can leave them on that eye for a longer period of time without having to worry about taking them off, because they can just push oxygen to the cornea so much better than the old contact lenses used to.
Is it like a different material that the new ones are made out of? Is that the difference?
Yes. Yeah. It's called a silicone hydrogel contact lens. So just different. There are over, my good gosh, I lost count now. there are over 30 different plastic polymers that contact lenses can be made out of. And then off of that, you branch into how much percentage water the contact lens has. Everybody has different tear chemistry. And a lot of times it boils down to how a contact lens is going to work out for you is how that tear chemistry, okay, or your tear chemistry, which is unique to you, jives with the material and the coating of that contact lens. It may seem like a simple little piece of plastic. There's a lot of technology going on in that thing. It's amazing.
Well, it's amazing to me how it corrects your vision, like that little silicone plastic thing,
It is amazing, but if you actually happen to think about what's going on, it makes sense. Your cornea, the clear part of your eye, and the average eye is 500 microns in thickness. Okay, 500 microns. Okay, that's half of a millimeter. There's
like a millimeter on a ruler or whatever.
Yeah, half of that.
Okay.
So you're adding something that's really thin on top of that to cover or make up for a loss of that. So it makes sense that just something really, really thin is going to compensate for something that's really thin to begin with, right? So it's like saying, I have a piece of wood that's 4 inches thick.
Mm-hmm.
Okay? Now I'm adding 3/4 of an inch to that. That's a significant.
Is that all vision is? Is the thickness of your cornea?
No, vision is more than that, but it's part of it. Think of the eye as we call it, and if you were taking physics, as an optical bench. Okay, you have elements to that eye. You have the cornea, the clear part of your eye that has a curvature to it, and then what comes next is their lens inside your eye. That lens has a curvature in the front, curvature in the back. Okay, and then you have the retina at the very end,
which catches the light.
Correct. So, and then that retina can be here or here, right? So depending on where this is, the curvature of this, the cornea, and the curvature of your lens, that makes up your whole prescription. So the thing we can control with contacts is this right here. We can put something over it to control the overall.
That's
focusing.
Interesting. So that's almost like a camera lens.
It is. Basically, you're just in the focus.
You're just kind of tuning it in, focusing it.
Mm-hmm. That's where
unless you have a real physical problem that's preventing something else going
correct.
on, right?
Yes, correct. That's this limitation too. The limitation is any pathology or illness in the retina, or the lens, which would be a cataract, or the cornea, which can have several different, just like the retina, several different disease processes that can affect that. But in a healthy eye overall, it's all just depends on how everything adds up to where it focuses on your eye.
What about the pupil? What's that doing?
Pupil,
just black, right?
Well, no, the pupil's not black. It's just a hole, okay, in the lens, the colored part of your eye. It looks black, okay, because
my soul's black.
Yes, it is. Yours especially. No, because your retina is catching all the light. Okay. Now, there are creatures, animals, that have a layer in their retina. It's called a tapetum, okay, that allows them to see better at night. That layer is behind the rods and cones, and any light that's not caught by the rods and cones to begin with reflects off of that and comes back, okay? Then it's caught by the rods and cones again, so you have about twice more sensitivity. But what you see is you see the reflection coming back at you like cats.
Oh, yeah. Dogs. It's like when you're shining a flashlight out there and
correct.
You see their eyes.
Mm-hmm. Yes.
That's interesting.
And we don't have that because, we're not developed genetically.
We've kind of evolved to just keep...
I don't know if we've evolved for that, but we weren't gifted with that.
We weren't gifted with that.
But we're not nocturnal, predators like cats
right,
are.
Yeah.
Correct. So
we're not nocturnal.
There's more of a need for them.
Like an owl,
Correct.
Owl has those great big eyes.
You bet. So the reason you see black is because when the light goes in the eye, it all gets absorbed by most of it gets absorbed by the retina, so there's no light coming back at you.
Uh-huh.
So that's why so the pupil has functions of if it's bright outside, it shrinks down because that's way too much light going into the eye. And if it's dark out, it gets bigger, so you can have more light going into your eye, so you can see better.
So is that like a muscle in there?
There are two muscle groups.
The colored part?
There are two muscle groups in the iris, the colored part of your eye. Think of your iris like a bike wheel. Okay. There are dilator muscles, which are like the spokes, on the wheel, and when they contract, they pull the pupil to be larger. There's also a little sphincter muscle in the very middle. When that one contracts, it makes people tinier. So there's one that makes people tinier.
There's one that pulls and one that closes.
Correct. Yes.
It's amazing. I mean,
the human
eyes are just insane, aren't they?
Yeah, God's a great engineer.
Yeah, the way that works.
Yes,
I mean, it's just so complex.
You bet.
And being able to experience the world by sight, your brain's translating all these images and lights. And
the eye is an amazing organ. It's just amazing.
It's crazy
what it can do and what happens. And the eye is just a small part of it. It captures light, but it produces electrical signals, and those signals are sent to your brain. Then your brain processes those signals into vision.
Yeah.
Your eyes have sight. Your brain has vision. So,
have you ever wondered if people see differently, like experience different colors? Like, let's say I'm looking at this can here, and this is orange to me, right? And to you, you would call that orange as well, but it could look like green to me. Correct. Do you ever think about that?
There are
possible?
There are people with color deficiencies. Definitely.
Do you think that's possible?
No, that is a reality.
That's
Definitely.
A reality.
Yes. Yeah. There are people with color vision deficiencies.
Or like the one color, we call it the same color, but to us, like what we're actually seeing, if you could see it displayed on a screen, would be different, right?
Correct. Yeah. You have these cells called rods and cones, and they perceive light a certain way, and when they capture light, and then that light is transmitted to electrical signal. And some people have the cones, which the cones convert are the ones that that catch or process color that just don't do it the same way that other people's eyes do. So you can have a person where the orange on this bottle looks like gray.
Yeah.
And so gray looks gray, and gray looks gray too. Orange looks gray, so they both look the same color.
Well, yeah, and that would be colorblind, right?
Yes, color deficiency. We have to call it deficiency because you actually can see colors, but you just don't see them the same way that.
So that's an old school term.
Yes, old school. Yeah, it's just like visually, legally blind type of thing. Yeah. You have a color vision deficiency, correct? And there are different varieties of those. Mm-hmm. Some are what we call blue yellow. Some we call red green. But it is amazing how we'll do a color vision test on people. We did yours a long time when you were 5, and there's a number there that's an orange number and a gray background. Patient can't see it.
Yeah,
they just all say that all they see is gray.
Yeah.
So there are definitely people that see colors differently than most people do.
It's crazy to think about. It really is.
But to that person, it's perfectly normal because they don't know any.
They don't know any different. No. Yeah. Right. And same as people that are, legally blind isn't a good term to use anymore, but people that see the world, maybe they've never experienced glasses or contacts. Let's say they live in a third world country, or even if you go back like 300 years, 400 years, you were just screwed, right? If you had bad vision in 1600,
you're a witch.
You're burned at the stake because you're not seeing things. Look at this.
Correct.
This beer is right here in my hands, and they're like, I don't see it.
Exactly. And the interesting thing about people that have vision abnormalities, the ones that are born with them, congenital, do better than the people that develop them later on in life because you learn to adapt, or your vision's always been that way, so you
don't know any better.
Correct. Now, if you've had 20/20 vision all your life, and also you're seeing 2400. That's disastrous.
One of my biggest fears is going blind.
Well, I think that would be number one in most people's fears.
It'd be horrible, yes. Right?
I think the most wonderful of our senses is vision.
Yeah,
definitely. I could lose my hearing, no problem. I could lose the ability to talk, no problem.
But sight vision, or hearing, which one are you losing if you had to choose?
No, I'm gonna lose hearing all the time.
I would too.
Definitely.
Yeah.
I love music. I really do. But
how could you live without music?
I want to see. Definitely.
But at least if you've heard music, like if you're deaf from birth,
you can remember it.
You don't care because you've never heard music. But
correct.
At least if you go deaf later in life, you can still play things in your head. Sort of.
I think you can. Definitely, no doubt. I believe it too. Mm-hmm. I don't want to experience that, but I think I can.
I don't either.
No.
Let's hope we never do.
No, definitely
not. What's one of the worst cases you've seen of somebody that didn't realize that their vision was really bad or something like that? Or on the flip side, one of the best one of the best cases of vision you've ever seen. Have you ever had somebody that's in there that has eagle eyes that can see superhuman?
Those are the most difficult patients to work with.
The superhuman ones?
Yes, because they any slight deficiency they see is just so catastrophic to them.
Really?
Because they have perfect vision, and all of a sudden you need a prescription of 0.5, and they're just beside themselves because I can no longer see 20/10.
Yeah.
That's 20/10 is amazing. You've seen 20/20 before. We've shown it to you at the very bottom of the chart.
Yes.
20/10 is half that size, and those people have a hard time. I basically it boils down to vision. It's still a sense. Okay, some people, for example, taste is a sense. Some people like
taste
hazies.
Would be horrible to lose. By the way,
some people, yes, it would be. Some people like hazy IPAs. Some people like stouts. It's a personal preference there. Vision too. Some people don't mind not being 20/20. I'll have a patient that comes in seeing 20/40, and they're happy how they're seeing. I can make them see 20/20, but you know what? They're perfectly legal to drive, and they're not complaining. I'm happy. Fine. See you next year. We'll just make sure that I'll put on your driver's license form that you don't need glasses.
Yeah.
Now you're talking about worst case scenarios that we've seen, and I think it boils down to some people have this attitude of it can't happen to me, type of thing. And I had a patient, probably 10 years ago, diabetic, hemorrhaging in his retinas, and I said, okay, we need to see into the retinal specialist to get this taken care of. Well, he had a trip planned to go back to Mexico to see family, and we scheduled his appointment. And he didn't tell me that he was going to Mexico. He left, and he knew that he had the appointment. While he was gone, he had that appointment scheduled. He comes back 3 months later and lost a lot of vision. Yeah, and he thought I can regain that back. Nope, too far gone. Too much damage to the retina, and and it was his fault.
I think I'd give up a vacation for that.
Oh gosh, you give up anything for that. And some people just think, we'll just come back and glasses will fix it. But if you've damaged the most important part of your vision, the retina, sorry, you're done. We can't help you there. So, and you try to educate people, and most people, you really, really do when it's a serious case. And some people just have this "it can't happen to me" attitude, and I'll be okay, and I'll wait, and your glasses will make it better, even though you drive it.
Seems like an old school, like an old man type
it does,
attitude.
And now it's really funny you say that, but it usually is a male. That it happens to. Exactly.
I would see. I'm the opposite. I would freak out if anything is going on with my vision. I'm freaking out. I'm coming in to see you.
No, most patients, I'd say 90% of patients are like that, but you have that small percentage that nah, I'm good. Well, it'll get better.
How much of that case, like a case like that, could you change with lifestyle? And would you recommend lifestyle changes for somebody like that?
Oh, well, of course, especially diabetes.
Yeah.
The unfortunate reality is, like me, my Wichita office, I'm Hispanic. I'm bilingual.
Mm-hmm.
I have a lot of Hispanic patients there. And the unfortunate thing is that the Latino diet is horrible for
diabetes.
Oh gosh, yes. Pinto beans.
The stuff
tortillas.
is the best, though. Right?
It's horrible. Yes,
tortillas.
Rice.
Oh, I love it.
I know it's horrible, but
it's a Mexican
that
rice.
Those are the worst things for a diabetic. So you're going to tell him you can't have that anymore, and someone's like, screw that.
Yeah.
But unfortunately, that makes things worse for you. And the unfortunate thing about diabetes eye damage is the patient a lot of times does not see damage until it's
serious,
very significant, and sometimes it's irreparable.
Yeah,
damage. So that's the unfortunate thing. Yeah.
Besides diabetes and things like that, what are some other like bad habits that people do daily that are causing things with their vision? Have you seen anything?
Well, smoking's a bad one too.
Smoking's bad for your vision.
Yes, you bet. It can make one thing that can hurt is cataracts. But you know what? We can do cataract surgery. But one of the worst things is for a person who has a disease called macular degeneration. That can make it worse. And we're dealing with the retina there. And once again, permanent damage to the retina is not we can't repair that.
It's irreparable.
Correct.
Right now,
so that's a bad habit there. Of course, that could cause problems. Another bad habit is basically not taking your blood pressure medication, or just not treating your blood pressure, or not seeing your medical doctor if you have high blood pressure and don't realize it, because that can lead to blood loss to your retina.
Silent killer.
You bet.
That's what they call it.
Yeah, high cholesterol as well. People have strokes with high cholesterol. Well, you can have a stroke to your eye, where you have a little platelet or clot or piece of cholesterol that can go all the way to the artery that leads to your eye, and it gets to the point where it blocks blood flow to your eye, and guess what? Your retina dies because of no blood circulation. So that can happen. Yeah, you bet.
There's a new fear for me.
There's new fear. Yeah, it is. The thing is a stroke is when you have a plaque of cholesterol
that gets caught.
That goes through, the artery,
which could break off anywhere in your body, right?
Correct. And if it hits a part in your brain, it's stuck, and then that part of the brain that needs that blood loses that blood. Okay, so it can happen to the brain. It can happen to the eye. Yeah. Well,
new fear unlocked.
Well, we had one patient from Colwich. He came in to see me. He's passed away since then, but it's been 15 years or so. He came in to see me, and he was very concerned because he said, I was at a wedding last weekend, and I kept bumping into people at the wedding. I couldn't see them. And, we checked his peripheral vision, and he'd had a stroke. Half his vision was gone. And he'd had a stroke in a certain part of the brain that affected the visual pathway that led to half of his vision.
Wow.
And he couldn't recover it. Now, the good thing is, we discovered that he had a stroke that would keep him from getting more strokes. So that you can't recover, of course. But yeah, there's another, lifestyle thing, that's leading to not taking your cholesterol medication or not seeing your medical doctor on a regular basis to realize that you have high cholesterol.
Well,
so high cholesterol, blood pressure, diabetes, glaucoma. There are a lot of things that can affect your vision permanently.
Smoking, which you never think of.
Correct. Smoking.
You always think of your lungs. You never think of your eyes.
Correct.
Blood pressure.
Which, and the smoking thing, all the other ones that I was mentioning are more quick and absolute, where smoking is more of a chronic thing. That can take time.
Just takes decades.
Just like
just
a can for getting lung cancer with smoking. You're not going to get lung cancer from your first cigarette.
Right. Well, the crazy thing is, it's like luck of the draw. It's gambling.
It is.
Some people live till they're 90 and they're fine.
And they're smokers.
They're
fine.
Yeah.
They've been blessed to have the ability to live beyond that.
It's crazy, man. It's rolling the dice. You just really never know. Mm-hmm. Some people, one famous doctor, it was either a doctor or scientist, said when the apocalypse comes and planet Earth is done, there'll be 3 things left: cockroaches, Ozzy Osbourne, and Keith Richards.
I love it. That is amazing because it's true. Because those two have pummeled their bodies and they're still
put it through
alive.
The ringer, and they're still kicking it,
Very true.
Playing concerts.
Now you can't understand what either of them say.
No,
but
and
they
look like a Halloween costume of themselves.
Catcher's mitt,
yeah,
like a Seinfeld episode. Your face looks
exactly,
like a catcher's mitt when he was smoking.
Oh yeah, when Kramer was smoking cigars all day.
Don't look at me, I'm hideous.
Well, those are all health factors for your body and stuff, yes. Right? I don't know a better way to put that, but as far as looking at screens and stuff, what kind of an impact does that have on our vision?
Screening?
People that just look at phone screens all day.
You know what? Here's the deal. The unfortunate reality is there is always has been, there always will be a person, company, or manufacturer that uses fear to sell a product. Okay, so having said that, you get more blue light. You probably heard about blue light.
Mm-hmm.
Okay, going into your eyes from 10 minutes outside than you do from 10 hours looking at your phone.
Oh, really?
Okay. Yes, correct.
So blue light shouldn't be a fear to people.
It should not be a fear, and not a particular fear. Now, there are people with certain disorders like exaggeration that we want to protect from blue light. Yes, wear sunglasses.
What about as far as going to bed? Like they say not to look at blue light, but an hour before you sleep.
You know what that does? It just basically messes with your sleep, melatonin levels.
Not your eye, not your vision.
No, not every, and the thing is not everybody has that problem. Okay, my wife, I had a hard time going to sleep. You're looking at your phone. Yeah, well, you might want to stop looking at that phone 3 hours before you go to bed.
Yeah,
because that can mess with your melatonin levels. Now, having said that, though, most phones nowadays do have a setting to where can they decrease the blue light coming out of the screen.
Got set on mine.
There you go.
Yep.
So you shouldn't have that issue.
They scared me enough.
Yeah, but all that's not causing vision loss. That's causing for you a sleep loss pattern if you're susceptible to it. But not everybody is. Now we're looking at phones. Okay, looking at a phone is no different really than looking at a book. Okay, you're still just looking. Okay, the big thing is working distance. Don't put that thing 2 inches in front of your eyes. Put it a comfortable distance in front of you, because there have been plenty of studies that show that the more near point work you do, the higher your likelihood of being nearsighted. Okay, not losing vision, but just being nearsighted. And there was a study done in the late 70s to the mid 80s, and it was done in southern China and northern Laos, which are bordering countries.
Mm-hmm.
They are genetically same people, but China, those kids go to school 8-10 hours a day, and in Laos, Laos is a third world country.
Yeah,
and it was amazing the incidence of myopia or nearsightedness in China compared to Laos. It was so much more.
Really?
It was incredible. Having said that, though, I'd rather be smart and be educated, be nearsighted, than, not educated and not need glasses.
Oh, you were giving me hope there, Dr. Rios.
But
I was like, all those years of me being a jackass and not reading paid off for me.
But here's the deal, though. Not everybody's susceptible to that. It's just people that are. Some people like my 3 children. Okay, my oldest is a couple of years younger than you. She's a low nearsighted prescription. My son, he's 21, the eyes of a hawk. Okay, my youngest, she's 19, and her prescription is pretty strong. And they both, I guarantee, they both look at that phone the same amount of time per day. So obviously, my youngest one is one that falls in that category. That near point work affects her, or it could be just genetics. Okay, but there definitely is a group that near point work, extended near point work, will cause myopia progression. Now, having said that, it's myopia progression doesn't mean you're going to lose your vision. You're just going to need stronger glasses. What? We can fix that, right?
Yeah.
We can do it through glasses, contacts, or LASIK. Yeah, glasses, contacts, or laser surgery. Let's take care of it. It's move on, do your thing. But the most important thing is if you keep your working distance when you're looking at things, I always tell patients, put your hand to your chin and look where the distance of your elbow is. Hold things no closer than that. This is usually 16 to 18 inches.
Oh, yeah.
And if you don't hold that thing 2 inches from your eyes, because that can cause myopia progression if you're susceptible to it.
So it's more about like the distance of something you're looking at rather than it being a screen versus
Correct.
a book page or whatever.
Near point work, whether it's a phone or it's a screen. Correct. Yeah, definitely.
I read something on the internet once that, all these little tips and tricks, especially if you're on like Reddit or Instagram or whatever, and somebody said one time that if you follow this 20-20-20 rule, have you ever heard of that?
Oh, of course not. No,
of course not.
Because
okay.
I know. But give it to me.
The rule is every 20 minutes, look 20 feet away for 20 seconds and focus on something. So like, if you're looking at a computer screen, every 20 minutes or so, just glance away and look at something 20 feet away for 20 seconds at least, just to refocus, Do you think there's any truth to something like that?
There can be, but there's really not been an actual scientific.
There's no data to back that up, really. It's just kind of
that up. Now, that can help some people that tend to overfocus and relax their focusing. Yes. Yes, that can help you if you have an overfocusing issue and your eyes just get tired. Relax
strained.
and just chill, and look away for a while. But that doesn't mean that your prescription won't progress if it's destined to progress. Because if you think about it, you're just doing it for 20 seconds. while you're spending how many hours in front of
maybe
that
an
screen?
hour or two looking at a screen. Well, it's supposed to be every 20 minutes, I guess, right?
But nowadays, do you really spend only 1 hour looking at the screen?
No.
No.
Get on your phone and look at your screen time.
Correct. Yeah.
It's going to be bad.
I think mine's like 6 hours a day.
Yeah.
I'm like, seriously?
It's terrible to look at. Yeah.
Maybe it's not that bad. I don't know if it's 6 hours, but I'm like, whoa, I spend that much time for that screen? It's crazy. And the thing is the biggest concern is patients have concerns about losing vision. No, you're not losing vision. Your prescription's just getting stronger. You know what? We can take care of that. We'll move along and, hey, here's a new pair of glasses, new pair of contacts, and you're good to go.
That being said, though, as you age, your vision probably does get worse. Is that true?
The funny thing is there is a thing called pseudomyopia. Pseudo, fake, okay? You're talking about being in front of the computer screen. Okay? Let's say you are a patient that is likely to have pseudomyopia, okay, or more likely to get it. You're in front of that computer screen all day long, okay, from 8:30 till 2:30. Then 2:30 you leave and you come see me at 3 o'clock. Your eyes aren't able to relax fully from focusing on that screen all day long, so you can't relax the whole way far away. Okay, so because of that, your prescription's stronger now. Okay, so we give you glasses to make that prescription stronger. Okay, and somewhere along the line you age and you become 45, and now you start losing your focusing ability. Okay, so now, like, wait a minute, I can't focus to make things clear far away through these glasses because I lost the focusing ability. And guess what? Your prescriptions become less. So some nearsighted people, okay, actually can become less nearsighted over time, anywhere between their late 30s to the late 60s. So that can happen, and I see it happen all the time. And it's just because we call pseudomyopia, and you can't control that. You just, it's a lifestyle thing, and hey, you got to work, you got to be in front of the computer screen. I'm not going to say, hey,
right.
So, but it happens, and
Does age actually diminish your ability to see, though?
Now, you're young, okay, and heaven's helped you so far with youth and vitality.
I've been blessed.
Yes,
I have the best vision in my family, I think.
You do. Now, you can sit in this style for 30 minutes probably, right?
Yeah.
Have your mom do that. Can she do that?
No.
Correct.
No.
Okay, so what tells you that your eyes are different from the rest of your body? Right? Everything ages, right?
Everything ages, yeah.
Correct. So,
I don't believe so.
I'll have an occasional, but you know what? You're at the peak of your health right now.
They say 27 is like your peak, isn't it?
No, I'd say 32, 33.
Oh,
you
I'm
got
still
more.
going up.
You got more.
Still climbing, baby.
You'll start declining a little bit later, but enjoy it while you can. Okay?
Yeah.
Because look at yourself in the mirror every day and say, I'm awesome, because you are. Okay. Because someday you'll be my age and say, I'm not awesome
you've always made me feel good when I come in there because you've told me that I have this really good squint.
You do. Yeah.
Like when I'm at a baseball game, I can squint down there and see shit,
You can squint like a king, man. You do.
Got that Clint Eastwood squint,
yes. Oh, there you go.
I brag about that to people.
Okay, we know your age. Talk about Clint Eastwood. You can say you have an old soul.
An old soul, yeah.
That's right. Yeah.
Clint's my man.
That's right. So, yeah, it just, we lose things as we age, and we do lose nerve fibers die off as we age, and that's more communication from your retina to your brain. So there's no way a 95-year-old can see 20/20 like an 18-year-old.
Have you ever seen somebody in their 90s that can see 20/20 vision?
No.
Never?
20/25.
20/25.
It's pretty good.
So very good still.
That's pretty good. You know,
Yeah.
that's pretty good. I don't have occasional, because of lifestyle, patient that's in late 80s and say, well, that's still not clear. And they've had cataract surgery already. Their corneas are clear. The retinas are clear. But you know what? You've been a smoker all your life, and you're diabetic, and you don't control your diabetes really
Things
well.
are just worse than...
And I'm sorry, that's the best you can see.
Yeah.
We can't make you see any better. And unfortunately I bring up that, the story of, hey, can you sit in this style for 30 minutes like you could when you were 5 years old?
Right.
No, they will make you think you can see like when you were 5 years old.
Yeah.
And that's just a fact of life.
Just the way things go.
Everything ages in your body, and the eyes are no different. Period. We just have to live with that reality. You're not going to go blind, as far as
just from age itself.
No, I have a 97-year-old patient that sees 20/30. That's pretty awesome.
It's pretty good.
Heck yeah. I mean, I want some of that. When
yeah.
Definitely.
What is your vision, by the way?
I'm 20/20 still.
You mind me asking?
I'm still 20/20. Yeah.
20/20 from birth?
No.
Did you get LASIK?
I had LASIK. Well, I have a very interesting story on my vision. I had a prescription as strong as your mom's.
Seriously?
Yes. I had LASIK surgery in 2000. Okay. But I asked the doctor to undercorrect me because at that point, I knew at some point I was going to be over 45. So I was a little nearsighted. And, I'm one of those people that, yes, near point work makes you progress a little bit more. So at some point in my early 40s, I was about a 2.0, a little nearsighted. I can still drive legally without glasses, but I needed glasses or contacts to see better. Let's fast forward to the year of 2016. My brother, in December, was diagnosed that year with leukemia. And by the grace of God, I was 100% stem cell donor match. And
really?
So, yes. So, which is incredible because, being Latino, the database for stem cell donors is 80% Caucasian, and the rest is every other race combined.
Wow.
So to try to find a match would have been crazy. So
why is that? Is that because they're only pulling from the United States?
Well, I think so. And I just think that Latinos are a very mixed, group as far as there's a lot of white involved in Latinos as well.
And it's not just from one country usually. It's from multiple.
Yes. Spain, Mexico, Southern America. So just
so the fact that
the
you
genetics
matched
go
was
crazy. It was a gift.
It's a miracle.
Because he was a friend of mine that's a medical doctor, said he had a 40% chance of survival.
Wow.
But like I said, so the great thing is I was able to donate stem cells to him. You get injected with a medication for 6 days prior to donating stem cells. This medication basically makes your body produce more stem cells, and it also makes them come out of your bone marrow into your bloodstream, so they're just flowing in there like crazy. Your blood's like, full of stem cells.
So it's not like it used to be? Because I've seen like horror videos and stories where they used to have to extract it from like your pelvis or whatever.
Correct. That's the amazing part now. It is basically this medication just makes your stem cells come out.
Really? So it wasn't painful to donate?
No, not at all. No, not at all. But one of the rare side effects of this medication I was injected with over this 6-day period was cataracts.
Ooh.
So I developed drug-induced cataracts, which made me extremely nearsighted. Basically, 4 times more nearsighted than your mom.
You did?
Yes. So I had to get cataract surgery last year.
And that's not something that goes away on its own?
Oh, no. It was just crazy.
Cataracts don't go away on their own ever?
No, my cataracts are just progressing just ever so
That had to have been a crazy experience, being an optometrist.
Yeah, the eye doctor gets the cataracts.
Going through the cataracts.
Yeah, exactly. Well, we're all gonna get cataract surgery long enough anyway. But to have the kind of cataracts I had was just an extremely crazy experience. But you know what? Even if I was told to begin with by the doctors that having cataracts would have been my most likely thing to happen from donating stem cells, I don't care. Let's do it, because cataract surgery is an incredibly safe procedure nowadays.
Really?
Yeah. So my vision has had its different changes throughout life. It's crazy how I've gone through so many changes,
especially for your profession.
Correct.
For somebody to be.
But the good thing for me is that I have first-hand experience to give to my patients.
That's true.
I can tell them what it's like to have LASIK surgery. I can tell them what it's like to wear soft contacts, hard contact lenses, cataract surgery.
You've been through it.
You bet. Yeah. It makes it.
Nobody can try to BS you and.
You cannot. No, I'll tell you what it's like.
I'll tell you what it's like.
The great thing is for having cataract surgery for me was really good because I've observed it. Okay, but until you're the patient that's having it done, it really gives you a different outlook. And it's amazing. Cataract surgery is incredible. You're in the surgical center for about an hour. Your surgery lasts about 5 minutes.
Do you go under for it?
Well, not under, but you are injected with some intravenous Valium.
So you're doped up.
A little doped.
But you can still see what's going on?
Well, you can't because you have a patch on one eye, and then your other eye is covered, with a surgery. So you can hear what's going on, but it's all a happy thing, So it's a good thing.
I would totally put me under. I couldn't do it.
Well, we have had not several, but a few patients that are incredibly just nervous about anything to do with their eyes, and those do undergo general anesthesia. Believe me, put some Valium in your body, you'll be fine. You'll be good. Yeah, you'll be good. I don't think I'll be around for that day.
Is that general life advice, or is that just for surgery?
Let's talk about surgery, okay? I don't want to get myself in trouble. But you know what? The powers of Valium, pretty amazing. I never had Valium till that time, and it was. My wife said I repeated myself multiple times. Exactly.
I've seen my dad. I mean, my dad underwent some surgery where he did, the bags under your eyes.
Yep, I remember that.
Yeah.
Mm-hmm. Did he have Valium too?
Oh, he was drugged up. He said some stupid stuff. That was crazy. I mean, I'm sure I'll have to have that one of these days. Well,
I don't know. Your genetics are pretty mixed up between you and your mom, so you may be lucky and not have to worry about that.
I might have gotten my dad's vision and my mom's
there you go.
Skin.
There you go.
Yeah.
You'd be good.
I am by far the most lucky out of my siblings with sight and teeth and everything. I have great sight. I've never had to use corrective lenses for anything. And my teeth, I did have braces for a year, but it was kind of just to do it, I think. My teeth I never used a retainer or anything. Now, I've broken some teeth out.
Well,
but
that's all on you.
Yeah. But when you look at my siblings, like, they all either have to have corrective lenses or they have to have real teeth repaired.
You rolled the genetic dice. Good for you. I'm happy for you. A little jealous, but I'm happy for you.
I'm happy for me too, and I'm the one that seems not to care the most about my health, which is a bad thing.
The funny thing is you will reach that day, and I'll still be around where you can't read up close, and we'll have fun about that.
You think so?
Oh, everybody does.
What's weird though is one year, I don't know if this is in your charts or not, or if you even remember looking, or if you've looked through the charts, or if you even remember this. But
I looked through your chart today.
I think I improved like 1 year.
You did.
You told me my vision got better.
You did. Yeah, I looked at that too because I was thinking, next year. Nope, not next year.
Not yet.
He's cruising. He's
not yet. Still got youth on my side.
And that's just the way it is. Some people, regardless of what your parents' vision is, you have your dad's vision. Which is good. Yeah. You'll be fine.
Well, what's crazy is he actually had some glasses for like really far away things. Like I said, if you're at Arrowhead Stadium or something, and you're looking down there. He had corrective lenses, and when I put those on, things sharpened up a tad.
I know, yeah. You have a little bit of correction, definitely.
Yeah.
Like we talked about how vision is a sense. You have your own sense of what's acceptable vision to you.
Mm-hmm.
Yes, we can make it clearer, but you know what? I'm happy the way I am. That's perfectly fine.
Yeah.
You're 20 happy. You're not 20/20, but you're 20 happy.
20 happy.
Yeah, I like using that term. You're 20 happy.
I could be a pilot, I think.
Yeah.
If I wanted to.
I think so. You have to wear corrective eyewear, though.
You think so?
Yeah. For that, you would.
That's not school, then.
So forget about being a pilot.
I want to be Tom Cruise, dude. What's crazy, though? Speaking of LASIK real quick, I just wanted to throw this in there. Greg Smarsh was my former teacher in high school, and he had LASIK back in like the 90s, he said.
Yeah.
And that was back when they took a knife and they like cut slits on your cornea, right? Am I mistaken by that?
You are mistaken, yes. Think of your cornea, okay, it's a dome, right? Okay. And what goes on is there's a instrument that's put on your cornea like this, okay?
Is this the old way you're describing?
No, it's still the same way.
Still the same way?
Yeah, you bet. LASIK.
Really?
Yeah. He did it early too. Like he did it by a year before I did my LASIK.
I heard, okay, so you can correct me here though, but I heard that like nowadays it's a much better procedure than it used to be. Is it the same thing?
It's the same thing. No.
Really?
Better procedure mean we have there's more correction you can correct than before. Okay. No, it really has not changed much since it's happened.
Wow. Well, that's news to me.
No. It just basically there's an instrument that just goes on your eye, and then it pushes on your eye to raise the pressure in your eye. It makes nice tension on your cornea, the clear part of the eye. Then an instrument just comes across like this on your cornea, okay, and basically slices.
When you say instrument,
a piece of your cornea,
like a knife.
Yes, a diamond knife, and then it doesn't cut it all the way across. It leaves it to where it's like a hinge, like a flap. Then that flap is lifted up, there's anesthetic. You can't feel it.
Sounds awful.
There's a flap. It's lifted up. While it's lifted up, there's a laser that touches your cornea that's exposed, changes the curvature of it. Then that flap is put back in place. Okay?
You're kidding me.
And the amazing thing about the cornea is, as soon as that flap is put back in place, it just seals back up.
There's no healing time?
Healing time is a relative thing. And as soon as you put that baby on, it's on, period. It really is. It's back on again. Now, you do wear a shield, for a couple of days, just to make sure you're one of those that is a weird case and it doesn't, it can slide off to make a heal it 100%. But no, you go in blurry, you walk out clear.
Who figured out that you could do that?
Well, just, the amazing people out there. A lot of incredible,
really smart people.
Science, and it went through a lot of trials and errors, and a lot of
those poor people that first tried that.
Correct. Yes. I wouldn't say
we're just gonna slice the top of
the lab rats and the rabbits that went through. A lot of rabbits lost vision.
Luckily, rabbits eat carrots, which are very good for your vision.
Let's not go there.
No, I know that's
it's a little wives' tale. I know. Okay, I'm glad you do. Thank you very much. We don't want to go there. Definitely not.
I'm sure you hear that all the time. Man.
Oh gosh,
tell him to eat his carrots.
I know. I had this wonderful Down syndrome patient he lived into his late 50s, which is rare for Downs.
Yeah.
And he used to tell me every year he'd come in, "Doctor, I eat carrots every day." You know what? I said, "Good for you.
Keep it up, man."
Yeah. I feel good about that. You're good.
They're not bad for you. So
no, they're not. Definitely not. But they don't make a lick of difference in what your vision is going to be, for sure.
Yeah. So. Not even does placebo carry over to vision?
No, placebo does not carry.
Because it happens sometimes with heart rate, blood pressure, things like that.
You can't affect the optics with placebo.
Yeah.
Right.
Because they're more of just like an instrument almost,
Correct,
like a camera.
Yeah. It's an optical bench like we talked about, the cornea, the lens, and the length of the globe of your eye. No placebo is going to affect that.
Well, you made me feel a lot better about LASIK now, because I was envisioning like somebody with a scalpel coming down and making little tic-tac-toe lines on my eye.
Now, having said that, before LASIK surgery was RK, radial keratotomy, where a doctor would use a blade also to make cuts on your cornea, like spokes on a wheel, usually anywhere between 6 and 12. And depending on how nearsighted you are, that would decide on how many cuts and how deep they would be. That is no longer done, because that is indirect way of correcting your prescription. And I have so many patients that have had that done that are no longer seeing 20/20 and are not correctable at 20/20 because so much corneal distortion from that surgical procedure.
Yeah.
That would be somebody coming in with a knife and cutting your eye, But once again, you don't feel it. You have an anesthetic.
I feel like you can pump me full as many drugs as you want, but if somebody's coming down with a knife on my eye, I'm going to be freaking out.
But Jesse, when I check your pressures in your eyes, you're flinching anyway. So I completely understand that. That's your dad right there.
That's my dad, yeah.
Yeah, exactly.
What's weird, though, the one thing that I did come to you for a while back, I remember I was seeing a lot of those little floaties in my eyes,
Mm-hmm.
When you look at it like a blank sky or like a blank piece of paper.
Very true.
I see these little floaty things, you know what I'm saying?
Mm-hmm.
But you told me those aren't bad.
Very normal. If you live long enough, you're going to get floaters. That's just a fact of life.
You're saying I'm old.
Heavens no. but I don't know if I want to go back to 27, but that's a great age. But floaters happen. It's just the way it is. They're unavoidable, and I think a lot of it depends on the individual, how astute you are, your brain noticing them, or you notice them and they start to go away because they become background noise.
Yeah.
Now, there are certain disorders that can come with floaters that can be an issue, like a retinal attachment. And of course, we see patients, whenever they talk about all of a sudden seeing floaters, says, come on in, make sure you don't have retinal attachment.
Yeah.
But most of the time, floaters are a benign thing that happens as the gel inside your eye changes over time.
Okay.
Definitely.
Yeah, that's good to know. That was a relief when I came in to you and you told me that.
Yes, and that's the thing is the ones that freak out over it most are the ones that have really good vision.
Yeah.
Because, oh my gosh, what's going on?
What's going on here?
Exactly. Yeah. People like me, like, well, that's another thing.
Alrighty, well, Dr. Rios, can you tell us a little bit about what school's like whenever you decided to go into being an optometrist, whenever you took that route? What was it like going to, I mean, you've had a lot of school.
You bet. Yeah,
well. You have like 3 degrees, don't you?
I do. I actually, I went to Southwestern College in Winfield, Kansas, and I was originally going to start with a BS in biology because I knew I was going to optometry school. I ran cross country and track while I was there. I met my wife, then girlfriend, my sophomore year there. She was 1 year behind me, and I had enough injuries to where I knew I was going to run. I could run 5 years, with a red shirt. And I thought, what the heck? I'm going to pick up another degree. So I picked up a BA in chemistry, and along the way I decided to pick up a BA in art as well. So I went to college for 5 years, and then optometry was 4 years. And your first 2 years, nothing but, it's very similar to medical school. First 2 years
you have to have a bachelor's first, right?
Oh, you don't have to have a bachelor's, but by the time you get all the requirements, you're pretty much good.
You're pretty much there.
Yeah, exactly. So, because you required so many hours of, for example, like getting into optometry school, you have to have zoology, botany, biochemistry 1, biochemistry 2, organic chemistry 1, organic chemistry 2, general chemistry, physics 1, physics 2. By the time you add all that up, you're getting a degree, and just the way it is. And then optometry school, your first 2 years are academics, and it's crazy. It's just amazing how, you're talking about a full-time student in undergrad is 12 hours. Well, optometry school, your first 2 years, you're 18 credit hours to 20. Our third year, we're seeing patients 3 half days a week, but then we're averaging between 22 and 24 credit hours. And then
this is a full-time thing. You're not working outside of this.
No, definitely not. And then your last year is just, clinical rotations. Which is great because you get the patient experience. You get to be,
which is basically the same as regular med school.
Correct.
Yeah, you're doing your rotations.
Correct. Yeah.
The only difference, talking 8 years, like when you're done with it.
No, the only difference there between med school and optometry school is in med school you're required to have a residency. Because I think they're like slaves. No, I'm just kidding. No, but because the med school is different because you have so many different branches of medicine in medical school.
It's crazy.
From being a retinal specialist to a general physician. Just so much in between. Oncologist. So you have to have a residency in your specialty, whereas optometry is more generalized. So it's like I am your general physician. Okay, you have cataracts. I'll say to the cataract specialist. You have macular degeneration. I'll say retinal specialist. You have a corneal disease. I'll say a corneal specialist. So I'm your central location for your general care.
General practice physician or whatever, like somebody that sees kids for physicals, like an MD would do.
Now, I can take care of other things, like, for example, if I had a patient today that had been mowing, and all of a sudden he has pain in his eyes, and fortunately he was smart. He wasn't a typical male and waited 2 days. He actually came in at that time, and I wound up finding a foreign body underneath his eyelid that was scratching his cornea. And, I flipped his lid and I scraped it, took it off, or I was talking about the corneal ulcer patient. So I deal with a lot of general stuff, but I can also deal with other things like medical issues. And then, of course, there are certain things outside of my scope of practice that general specialists do, like cataract surgery and things like that.
So from your optometry school, you could have gone and specialized in any of those fields?
You can go into a specialized field if you so wish, but I really like the general.
You like the general
because
practice?
I see everything, which is great. Like I said, I just told you about the today I had the guy with the foreign body under his eyelid to the little 8-year-old. They just need updating.
It's lying about wanting glasses.
You bet, yeah. No, he didn't lie today. That one didn't lie. So he just needed to update his prescription. I'll get one sooner or later.
You'll get one of those again, yeah. So if somebody wanted to go into optometry, they could expect to be in school for...
You can be in school 4 years for sure, pretty much.
You could do it in 4 years, you think?
More likely. For undergraduate, yeah. Before you get into optometry school. Now, having said that, you have so many kids now with school. It's changed even from you. You can graduate high school and have 20 credit hours.
Yeah, my brother just started at WSU this year, and he actually had enough credit hours to bump him to a sophomore status. There you go. Yeah, right out the gate.
So as long as you have the classes required for you to be accepted into an optometry school, it could be 3 years, definitely. Probably not less than that.
Yeah.
Because that requires, like I said, so many other higher level classes, just like med school.
I mean, minimum, you're not going to be practicing real optometry until you're probably 24?
At least 26.
26.
Because, by the time you graduate high school, you're 18. Let's say you get 3 years of college, that's 21. Optometry school is 4 years, so 25.
Okay.
I started practicing at 26.
Yeah. And if you're just doing the regular average student pace, you're going to be 26, 27 probably.
Correct.
Before you start doing. Yeah. Mm-hmm. What's some benefits to it? Like, what would you recommend if some kid walked up to you and said, "Hey, Dr. Rios, I'm thinking of being an eye doctor, or I really like what you do. I want to get in the medical field, but I'm leaning towards optometry." What would be your advice to them?
Well, one of the nice things about optometry is, as opposed to, like, for example, some professions like being a pharmacist, there are a lot of independent optometrists. So you can be your own boss. You don't have to be owned.
You can open your own business like you have.
Correct. A lot of doctors are employees of a big practice or a hospital. I think a lot of medical doctors that are their own bosses, a lot of times they're in smaller towns. So what's one of the advantages, I think, of being an optometrist? You're an independent practitioner, and you don't have to be owned by a corporation or an entity. And like I said, once again, you get a variety of patients.
You also get loyal patients, right?
Yeah,
they're with you for life.
Gosh,
usually.
I see you forever. Yeah.
I'm probably due now that we talk about it.
Overdue.
I'm overdue.
I looked at your chart today, like I said. But I have patients that have been seeing me since I started. It'll be 28 years ago. This 27th of this month, actually.
Really?
Yeah, 28.
Dang, so I'm almost a day oneer then.
Pretty close.
Pretty close.
Pretty darn close. Yeah, you bet. So that's, to me, is, and the flexibility of being your owner, your own boss. You can flex your schedule to suit your certain needs. When I was younger, I ran in undergraduate, and I was an All-American a couple of times, and then I that carried on to running competitively and competing after optometry school, and it allowed me to have a flexible schedule to compete nationally, and go places here and there, then of course as kids start coming around, you have to start, pulling the strings back and settle down. So I get great freedom and flexibility in my working hours, and
that's a huge plus.
It is a huge plus, and I'm my own boss, and I do get a great variety of. I really can do this till I'm 80 if my body lets me. It's easy on the body. I'm not digging ditches. It's not
physically taxing.
No, it's not. And you see your patients every year, and it's like catching up with a good old friend.
As long as your vision's good, because you don't want to be the eye doctor that rolls in and you're like, let's look at your chart here.
That would not be a good thing. I might lose a few patients that way. Correct. We'll make sure I keep my vision well. Definitely.
Well, real quick, we're at an hour and 15 already, which is crazy.
Dude, what the heck?
I know, it goes fast, doesn't it?
It sure does.
It goes fast. If you could touch on real quick what it was like starting your own business as an optometrist. Is it easier if you already have that degree and you're already a doctor to open up your own practice, or do you go through the same struggles that a lot of small businesses already go through?
I think I've gone through a lot of struggles that some people have gone through. I started with Dr. Graham in Wichita office, and I had no database for patients, and he would give me some patients here and there, and I slowly started building my own practice. Which was a little different. It was always, I started in Wichita in '94, here in '96, and it was from an optometrist, Jim Dienst, who had been here, I think, for 4 years prior to that, and he decided he wanted to go in the military and practice there. And so I had an established patient population here, but, small towns are different. You're new, do we know this guy? Do we trust this guy?
Yeah, this is an outsider.
I always likened that beginning here in Colwich to in Antarctica. Okay, where are you going there? To where you have the penguins at the edge of the iceberg, and they want to jump in to eat. Okay, but there are leopard seals there.
Yeah.
Okay. So like, So they get crowded, and finally one gets bumped off because it's crowded, goes in the water, and does it get eaten by the sea lion, or does it get to eat some fish? Hey, it ate fish. It's fine. Let's all jump in.
That's what you compare yourself to.
Exactly right. Yeah.
Here?
We're like, is he safe to go?
Are these sea lions gonna kill me, or
no? Is this guy okay?
Yeah.
And I got accepted into the college community a lot. And it's definitely been a really, really fun experience working here. It's a small town feel, which that's one of the reasons I came here, because I'm from a small town. I'm from Liberal, and I went to college in a small town in Winfield, and I like the small town feel.
I do too.
So small town feels, it's really, really cool.
I do too.
So yes, I think I did go through the same growing pains that you would with somebody without a degree in anything. You just have to
starting a business.
You have to start a business, and you know what? You treat your patients right or your clients right, and they'll come back to see you. And if you don't, they won't. But the big thing is you have to have a love for what you're doing.
That's the biggest thing.
Period. Yeah. And I do. Like I said, I'm talking about working till I'm 80 because I love my job. I really, really do.
Right.
I tell people I don't think it's a job.
That's what keeps people living forever too. Is having that attitude.
You bet. Yeah. Exactly.
The people that live the longest.
And I hear people say, if you love your job, you'll never work a day in your life. Mm-hmm. And I really can't recall a day, other than being sick.
You never really dread going into the office?
No, definitely not.
What about people that have like terrible breath and you're sitting over them all day? Do you ever
get that? What? Wearing masks has been awesome for that.
Did you used to get that though before
you
COVID?
Just turn the other way.
Somebody that just breathe,
which is better, one or two, and look the other way. That's the unfortunate thing about being face to face with a patient. And you'll get a few of those, but you know what? Those are far and few in between. And you just breathe in through your mouth and breathe out through your nose.
Yeah. Old woman, old Karen out there, she thinks that she's real sneaky with the booze till she goes see the eye doctor, right?
That's right.
And then you can smell it.
Oh, no, we get those, yes.
We got those around here.
Yeah, we'll get those.
We have some drinkers in college.
Anywhere.
Including myself.
Anywhere. Well, I will say I do not believe you've ever been under the influence when you come for an eye exam.
No, I've never pre-gamed an eye exam. I can say that with
pre-game.
Honesty.
Oh, I like that term, pre-game. That's good.
All right, Dr. Rios, thank you so much. I mean, we appreciate you as a community. I'm speaking for college here, but, you've been a huge staple in all of our lives, especially people that are my age that have grown up with you our whole lives. So thank you for being there. Thank you for doing that. Thank you for helping people out with their sight and their vision. Thank you for coming on my podcast. Do you have any last words you want to say?
Thanks for having me. I can't believe the time's gone by so quick.
It goes fast, man.
All right. Thanks, sir.
It goes fast.
Appreciate it.
Thank you very much, Dr. Rios.
Thank you.
It's been a pleasure, sir.
Thanks.
Cheers, man.
Okay, cheers.